We're going to tell you just a little bit about what our vision and our mission are with the Institute for Genomics Education, Workforce, and Leadership at Sarah Lawrence College. It was ideated about for the past few years, but really has started to kick off with this season of conferences and building awareness to some of the workforce challenges.
Today we are in Nashville, Tennessee as a part of the Genetic Health Information Network Summit. And ahead of the summit, we are gathering key stakeholders across the genomic ecosystem to talk about some of the biggest challenges in implementing precision medicine.
The rate of change in science and technology for genetic and genomic sciences is a formidable challenge because truly we can't keep up. We need more people. We really have to swell the ranks of people who have this information and also share this goal of increasing access in order for us to move forward.
We can't do it alone. But we can be the institution that draws together partners across the landscape of genomics ecosystem to make a real change in the delivery of precision healthcare.
We want to hear from you and understand your perspectives and figure out how we can ethically and equitably really integrate some of these genomic technologies at the point of care.
I think Sarah Lawrence is a place that's clearly really committed to making healthcare available for everyone. I think the unique combination of being a liberal arts college that is deeply committed to the humanities and deeply committed to addressing the whole picture around genomics is really key to understanding this institute and how this institute is set up to really meaningfully address health disparities and to ask questions about technologies and their use and how they can be implemented in a way that is equitable and that meets the needs of a really broad and diverse population. Within the Institute, there are a number of initiatives ongoing that are really exciting. There's focusing on the thought leadership aspect. How do you convene people who understand this problem, who think about this problem in really different ways, and who can be key informants in the discussion about where things need to go? Then there's how do you leverage the history of genetic counseling at Sarah Lawrence? It's an amazing asset, and there are also many places that genetic counselors still stand to go and stand to learn, so continuing education for genetic counselors and other healthcare professionals. And then ideating new professions that don't exist today, but would be of value to the healthcare system.
The magnitude and rate of change of science and technology is creating a big problem in the delivery of precision healthcare because the workforce that we have today was largely created for a very different landscape. Until we can have a workforce that is trained or scaled to be able to deliver these scientific advances, we're really preventing our patients from accessing the care that could truly save their lives.
How have we evolved over the past 50 years and where is the workforce headed so that we can create evolving training programs to meet the need of where we're headed?
A diverse workforce really enhances the benefits of personalized medicine or precision health because you have providers in the workforce from a variety of different identities, backgrounds, and perspectives in order to genuinely and authentically support the diverse population that we're serving. This means that the Institute likes to throw open its arms to any and all kinds of partnerships. There's really no knowing what kind of input any one person or even group can add to the collective conversation. It really makes all of our efforts stronger.
Benefits to the partners are incredible. Firstly, being at the forefront in the beginning of this to understand and see all the perspectives, but then also to be integral in the research into the workforce and the ideas for what we may implement, and of course to be part of the team that ultimately sees the success of the work we're going to do together.
The Institute has really been nurturing this meaningful partnership with New York University. If you think about it, Sarah Lawrence College brings this critical and creative thinking mentality, a very strong social consciousness. NYU has this really wonderful global type perspective, really big data science, cutting edge healthcare practice.
So our discussions with Sarah Lawrence, I think, has led to throwing off some older assumptions of where and whom we can teach genetics. And I would say that the major impact, on me at least, is genetics have been taught to medical students primarily as a specialty, much later in their career. that the time is coming where I believe we could teach genetics in a much more substantial way to medical students in training, not the few lectures they get, but having these themes repeated to every year of their medical training.
We know that by drawing together partners from a wide variety of perspectives, we will be able to reach more students, we will be able to move things more quickly, and we'll be able together to address the critical gaps in delivery of precision healthcare.
We truly believe that there's an appetite right now within biotech and the healthcare sectors to really come together to identify and solve these challenges.
Building collaborations will be critical to implementing genomics at scale. We've seen industry and other organizations try to tackle this alone, and it's a systemic issue. It is going to take a system of collaborators and partners to really understand the full continuum of implementation.
We need a broader range of professionals to address the integration of genetics and genomics. And the only way you're going to change it is by bringing people to a place that is high on innovation and willing to try new things, willing to understand problems from many different perspectives, and willing to address those problems in unique and innovative ways.
Sarah Lawrence, our mission is to prepare students to solve the problems of and thrive in a complex and rapidly evolving world. We can't do it by ourselves, but we bring thought leadership and the ethical, humanistic perspective that is desperately needed for today.